The theme this year is working together to prevent suicide. To talk more on mental health and suicide, we have with us Carly Cutterbuck, an Australian volunteer with Australian Volunteers Program and a psychologist. How do we define mental health in simple terms?
Okay, so mental health can be compared to physical health. So when your body is physically healthy, you feel like you have a lot of energy, you can take on the world, and things aren't a struggle. It's the same with your mind and your mental health. So the difference between mental health and mental illness is that when the mind is ill, the things become a struggle, become difficult to do everyday tasks, and the emotions that we would normally experience, like anxiety, depression, stress or anger, actually become so overwhelming that people can't function in their normal everyday lives.
So what are the most common mental health disorders in the world?
Most commonly we're talking about anxiety and depression. That's pretty much the world over. So anxiety is a normal emotion, but this kind of anxiety actually stops you from leaving the house in some respects. Other really common mental disorders are substance abuse disorders, so that's alcohol and other drugs, which are either prescription, not prescribed to you, or illicit substances like cannabis and cocaine.
So what are some of the most common symptoms of mental health disorder?
Very good question. So you're looking for changes in mainly eating, sleeping and memory and concentration. So in terms of eating, you might lose your appetite. So you might not be hungry 3 times a day, you might have maybe 1 meal a day, or you might not feel like eating at all. The other change that might happen is you start eating everything. So you're always hungry, and it doesn't matter how much you eat, you always feel like you still want to eat some more. Changes in sleep is a big one. That's usually my first sign that I'm starting to get a little bit stressed, is having trouble getting to sleep. So feeling physically exhausted, lying down and your mind just won't switch off and it just keeps talking to you even though it's time to sleep. Or being able to fall asleep but then not being able to stay asleep. So you might find you're waking up in the early hours, 1 or 2 in the morning, and again your mind is kind of running and won't let you rest. We're talking about problems with memory and concentration, so finding it really difficult to be present in the moment. So you might find that people are talking to you but it's kind of not going in and you can't really keep track of what's going on. And loss of memory, just in terms of the small things. Where did I put my keys? Forgetting to bring something to a meeting, forgetting you had a meeting. So you might find that your colleagues and your friends are noticing that you're a bit more absent-minded than usual. We're also looking for changes in mood. So either mood swings, where you might be really agitated one moment, very angry and then very sad, or very anxious for no reason that you can really identify, and then really angry. So it feels like your mood is a bit out of control, or feeling sad or down, just basically feeling exhausted and not being able to feel like you can get back into your life.
Sometimes I think like everybody feels sad.
Yes.
Sometimes we go through bad day. So what is the difference between a bad day and actually suffering from depression?
Very good question. So a bad day lasts for a day or two. So everybody has bad days. I have bad days. I teach this for a living and I still have bad days. So a bad day will be, you might wake up in the morning and feel a bit under the weather, a bit tired, you might be a bit slower during the day, and you might find your brain is a bit foggy. And then on those days, you might take it a bit easy, might not overextend yourself, so might cancel a few appointments that you might have had, do some things to take care of yourself, and then the next day you're feeling okay. Or 1 or 2 days later, you're back to normal, as it were, you're feeling like yourself again. So depression, to have a depressive disorder, so for it to be called a mental illness, those symptoms need to last for longer than 2 weeks. And that's 2 weeks uninterrupted. So feeling sad or down for the majority of the day, most days. Losing interest in everyday things, including your food, so just not really seeing the point of eating. Losing joy. So lack of enjoyment in the things that you would really normally like to do. So if you normally like to do yoga or you normally like to go for a walk, those things don't really bring you any pleasure or any joy, so you kind of stop doing them. Feeling quite lethargic to the point where it's really difficult to get you, like you're dragging yourself out of bed. And you might start thinking about hurting yourself. So your thoughts become really negative, hopeless, helpless. Thoughts about the future just seem quite overwhelming, and your thinking gets quite negative. And then the social withdrawal. So social withdrawal might be the thing that your friends and family notice. So we're not just talking about cancelling a dinner date because you're a bit tired. We're talking about avoiding all social contact, including work meetings. Young people you might find lock themselves in their bedroom for days. So not just a couple of hours, that's pretty normal for a teenager, but we're talking days and weeks, not just hours.
Just to add to that, will it be wrong to say depression increases the risk for suicide?
Depression can create quite negative thinking, and yes, having a diagnosis of a depressive disorder does increase your risk of thinking about suicide, but that is absolutely not to say that everybody with depression will think about suicide. Just like everybody who thinks about suicide doesn't necessarily have depression.
Is addiction to alcohol, drugs or harmful substances considered mental illness?
Yes, it is. So we're talking about addiction. We're not talking about using alcohol 1 or 2 days a week and maybe 1 or 2 drinks. That's not necessarily addiction. So there are some people that can drink in a controlled manner. So they know what their limits are, they find it quite easy to stop, and it doesn't impact on their day-to-day life. Some people can't control their use. So we're looking for people that use more than they intend to use. They spend a lot of time either using the drug or getting over the effects of the drug, and they find they need more and more to get the same effect that they wanted. So it can cause mental illness, and it is a mental illness in and of itself because it changes the brain chemistry. So the reason that we get the effects from drugs and alcohol is because of the changes in brain chemistry that it gives us.
Generally, who are most likely to develop mental disorders?
Oh, that's a tricky question because there is no profile of the person who will develop a mental illness. So there are some things that increase your vulnerability. So in the same way that diabetes and cancer tend to run in families, so if your grandparents and your parents have diabetes, you have an increased risk of developing it. It's the same with psychological disorders. So some psychological disorders like bipolar affective disorder, depression, schizophrenia, and actually alcohol use disorders run in families. There's a genetic component to them. We're also people who experience big trauma. So we're talking about a very bad car accident or war or a natural disaster are more prone to developing mental illnesses simply because that experience at the time would have overwhelmed their capacity to cope. And that's really what mental illness is all about. People that suffer a lot of small traumas or a lot of small stresses, lots of small things can build up to a big thing. And if left untreated or we don't know how to cope with those things, it can result in a mental illness.
And I have actually recently learned about postnatal depression, which is also known as baby blues.
Yes.
So what exactly is postnatal depression?
Okay. So postnatal depression is in the year following the birth of a baby. Sometimes a mother can feel useless, helpless, guilty, very tearful, find it very difficult to get out of the bed in the morning or any other time of the day, and find it really difficult to bond with the baby. So postnatal depression is actually relatively common, and usually symptoms are within the first month or so. Like it's normal to have some ups and downs after having a baby naturally, but we're talking about downs that don't go away, and downs that can become so severe that the mother actually cannot meet the needs of the child. The other thing about postnatal depression is that fathers can get it too. So it's not only a big change for the mother, it's a big change for the father. So recently we've discovered that fathers can actually develop postnatal depression too. So it's very treatable. There are medications that you can take that won't affect your baby, and that can help you to pull out of the hardest bit of depression so that you can start moving forward. But the earlier you get it, as with any other mental illness, the better the treatment will be.
So I actually recently met a lady who confessed suffering from, who was diagnosed with postnatal depression. So she was telling me like she was happy when she had her first child, and after her second child she was expecting similar happiness.
Yes.
But after her second child, she told me that she realized one day that she was just sitting in her room and planning to throw her baby from the balcony and then throw herself. She said she realized that moment that something's wrong with me, and she went for treatment, and then she was diagnosed with that, and she did medication, and she's better now. So how do the mother know like they are suffering from that? Because most of the time I think you might be in denial.
Okay, so we're talking about symptoms that don't go away. So again, it's okay to have a couple of bad days, and you probably will be quite disrupted in your normal routine, but this doesn't go away. So it's not 1 or 2 days, it doesn't go away. The things that family and friends might notice is that the mother is quite withdrawn and isn't bonding very well with her child. That would be the main thing, is that they will happily give the child away even though they're quite small. They will, if the baby is crying or fussing or not okay, the mother almost seems like they can't tend to the child. So not only do they not notice, or they might notice but don't actually want anything to do with the child. That they're sleeping a lot, having difficulty getting out of bed. I know your sleep is disrupted anyway, but we're talking almost can't get out of bed. And yes, some of those very negative thoughts and those very, we'd call them pointy thoughts, they're very dangerous thoughts, that would definitely be a clue. That if you're feeling overly guilty or are thinking that you're a terrible mother, that you can't do this, that your child would be better off if it wasn't here or if you weren't here, that's definitely a signal that something is not okay.
I have a friend who is suffering from schizophrenia for some time now, for some years. Yes. And she is a very brilliant writer, and I wanted to know that can people with a mental disorder still perform well? Can they be asset to the company?
Oh, they absolutely are, definitely. So there are so many examples in history of famous people that had psychological disorders that led completely normal lives like you would never know. So when people have diabetes or some other chronic condition, we don't go around saying, oh, and by the way, I have diabetes. It's exactly the same with mental illness. So it can be controlled, it can be managed, and in some cases you can absolutely come through it and never have another episode again. So you can lead a normal life even with something like schizophrenia or bipolar affective disorder. In fact, those people are usually quite creative and see things in a different way than what we would see things, and can create great art, great movies, and have a lot to give back to the community.
Usually we feel like somebody with mental disorder, they are harmful to the society. We feel they might just harm you anytime. Yes. I used to feel scared also, when I was young. I used to feel the people with the mental disorder might harm us or be harmful to the society. But you were mentioning during the workshop last time that they are most vulnerable actually. They can be misused or harmed. So if you could stress more on this.
Absolutely. So people with psychological disorders, especially those that are untreated, are far more likely to be victims of crime than they are to be perpetrators of crime. So they're far more likely to be robbed, to be beaten up, to be shunned from their community than they are to harm somebody else. So often people with psychological disorders that are untreated are in a very scary place. They might be out of contact with reality. So when they see you on the street, they might not understand who you are. They might see you in a different way, and they have trouble reading emotions. So they might behave in big and scary ways, but that's usually more to protect themselves so that you will go away because they are afraid. So they're quite unlikely to harm you or other people. In extreme cases, people do, but it's a very, very, very small percentage. Unfortunately, these are the people that we see on the television. These are the people that we see on the news, because what they do can be quite big. So unfortunately, people understand that people with psychological disorders are violent.
As per Health Ministry's report, suicides are most common in rural Bhutan, amounting to about 88%. So how can we help educate and create awareness about mental health to rural communities? Because I think the educated lot, somehow we read about it, we can do research about it, but it's the rural communities who are not aware.
Yes, I think the wisdom is in the community. So the community knows what it needs, and it also knows what the stigma and what the barriers to accessing help are in their community. So I would like to see some community development where we actually involve those community members and ask them what they need. How do you need to understand mental illness and suicide? Because some of these things might be brand new concepts that, as you said, when you were small you thought people were just mad. And maybe some of those ideas are still in the community. So how can we have a discussion about these things and get the community to come up with answers for helping their community? Your community here in Bhutan is wonderful. It's very supportive, very caring, very empathic. How do we harness those things that you already have to extend to mental illness?
It is also reported that suicide is common among productive age. 15 to 40 years. So what could be the reasons?
That's difficult to say. Through different discussions with different people, urbanisation has happened very quickly here in Bhutan. Like, we're talking in the last 10 years. So in the West we've had maybe 50, 100 years to do what you've done in like 10 to 15. It's been very fast here. And with urbanisation comes a lot of changes that maybe people didn't see their parents or grandparents go through. So we learn how to cope with stress and anxiety and concerns from watching our parents and the way that they cope with those things. And if I didn't have that, then when these things come up for me, so I move away from my support structure and I move to a city where there's expectations for my work, there's stresses in earning enough money to be able to live, but also in the social comparison around what I have and what I don't have. The expectation around socialising is very different in urban centres than it is in rural centres. And then also there's a lot of alcohol that goes along with that as well. So I can find my stress is increased. I'm not overly sure how to manage a lot of that stress. I find that I'm drinking a lot more, and that's initially starting to help with my stress, but then it really doesn't help. I don't have the same social structures as I would normally have. I'm more isolated. I'm working longer hours than I normally would. And it's just, there's a lot of different pressures and stresses on me, and I'm not quite sure how to deal with it.
So suicide is said to be preventable. How can we prevent this from happening to an individual?
So suicide prevention is about noticing the warning signs that someone is struggling. So the most obvious warning sign is somebody talking about dying, wanting to die, being a burden to others, saying things like it would be better if I just wasn't here, nobody would miss me when I'm gone. So those sorts of things are indicators that someone is not okay. They might also be writing or drawing about suicide or harming themselves. They will have changes in their mood. So again, things that are out of the ordinary for them. So if they're usually quite a social person, and if they suddenly are not social at all, and we're not talking for 1 or 2 days, again, we're talking about like a week, 2 weeks, and you're having trouble connecting with them. Talking about mood swings, so if they're very low, and they're very low every time you see them, or they're very erratic in their mood. So again, they're angry, they're anxious, then they're sad, then they're stressed, they burst out in tears. So some of those changes in their mood as well. And also the same things about eating and sleeping. Eating more than usual or far, far, far less than usual, not being able to get to sleep or stay asleep. Some of the warning signs that someone's thinking about hurting themselves or might be thinking about hurting themselves. And the best thing you can do is ask. I know it's terrifying to ask the question, are you thinking about taking your life? Have you thought about suicide? But these are very important questions to ask because they will help the person feel like it's okay to talk about it. A lot of people think that if I ask them, I'll put the idea in their head, or after they finish talking to me, they will go off and act. That is absolutely not the case. So I've asked easily over 90% of my clients in my career, easily. And what that has done has decreased the risk rather than increase the risk because it has given them a safe space to talk about what's happening for them. People who are experiencing suicidal ideation are overwhelmed by their situation. They have far, far too many problems and they've got no resources to be able to manage them. So talking about suicide can change that. It can give them more resources and help them reduce the problems in their mind. Very important to talk about. And the best news is that you don't have to fix the problem. So if you do ask and someone says, yes, I have been thinking about hurting myself, all you have to do is go tell me about what's going on for you and listen. Just listen. Don't give advice. Don't try and fix it. Don't try and save them, I guess, from themselves. Just listen to their experience. And if you don't know what to do, simply say, I don't know what to do. Should we go and see a counsellor? Can I go with you to the hospital? Can I go with you to see a counsellor? So that you can share that with somebody else who has the skills to help them.
How can we as individuals, friends, family and society help a person who is vulnerable and who is suicidal? I don't know if it's the right word, suicidal.
Yes, yeah. Who is thinking about suicide, yeah. Ask the question, get comfortable with asking the question. That's a big ask, I understand that. I remember my very first client that I had to ask if they were thinking about suicide, and I was terrified to ask, and I was a little bit afraid of the answer. So it is okay to be worried about asking, but learning to talk about suicide is one of the most important things that you can do. And noticing that if they're not okay. Because sometimes when it's happening to us, we can lose track of how many days it's been happening for, or how many times I've cancelled on that friend, or we get so focused on just doing the basics. I have to get up, I have to go to work, and I have to eat, and like that's all I can kind of cope with. And we might lose track of how long that's been going on for. Friends and family are frequently the first ones to pick up that something is not okay. So if that is the case, ask. And then if the person says, I'm fine, that is sometimes the response that you will get, I'm fine, or everything's okay, or I'm just stressed right now, but I'm fine. Ask again tomorrow. Ask again the next day. Let them know that you're concerned about them. I'm worried about you. I've noticed that you haven't been coming out as frequently. You don't seem like yourself. Are you okay? Shows concern, shows that you're a safe person to talk to, and if you ask them again the next day. The same way as you would if they had the flu. Are you okay? Can I get you anything? It's the same thing with mental health. Are you okay? Can I help? And if they say no, that's okay. Ask them again the next day. And maybe one day they will eventually say, yes, please, I don't know what to do. And then again, just listen to what they have to say. Really, really listen. Turn your phone off, put it down, really listen to what's going on for them. Don't feel like you have to do this alone. Enlist other friends and other family to help and encourage them to see a counsellor so that they can help them identify what's going on.
Is there a helpline or support group in Bhutan to help people who are vulnerable?
Absolutely. So the Health Help Centre on 112 can definitely support you through a tough time. They can't do therapy per se, but if you are struggling right here, right now, or if you are worried about someone. If someone is in front of you, they are very distressed, they are talking about taking their life right then and there, remove everything that they could use to harm themselves. Don't leave them alone and call 112. They will help talk you through that and get that person safe. There are some support groups, or there are groups that are run by some of the youth centres around especially. Some of the drop-in centres have AA and NA groups, so Alcoholics Anonymous and Narcotics Anonymous, and there is a very active online community as well that people can join for anything from depression to anxiety to body image to bullying. So basically any social group can act as a support group because they will notice.
So your advice for our viewers
Is to take care of your mental health. The same way that you take care of your physical health, take care of your mental health. So that means getting enough sleep. And enough sleep is 7 to 8 hours. So sleep hygiene is really important. Put your phone down at least half an hour before you go to bed. Give your body clues that it's time for it to start to go to sleep. And if you're having trouble sleeping, learn mindfulness and learn relaxation techniques to help you sleep. Eat a healthy, balanced diet. So there's an increase of fatty and processed foods that I've noticed coming into Bhutan, and also the sugary drinks. So while they might give you a really nice energy hit, the dip can be quite severe. So a balanced, healthy diet is pretty important. Exercise daily. I know that sounds like a big ask, but again, it can only be for 15 minutes. So I'm cheekily using my walk to work and my walk home from work as my exercise for the day if I feel like I haven't done anything else. Learn how to relax. And I'm talking about internal relaxation. So learn how to manage your thoughts and learn how to meditate and how to apply that to your life. Do things that are fun. This is my most favourite homework to give to any client, is go do one thing for yourself because you can. Because the enjoyable things that give us a lust for life, that we're passionate about, are things that help us to shake off some of the things from the day. And I'm talking about doing that every day. And talk. Talk often and talk frequently. Share what's really going on for you. Sometimes we feel like we're burdening other people. However, they wouldn't ask if they didn't want to know. And they wouldn't ask if they weren't worried about you. So really share what's going on for you. It's okay to not be okay. There are some days when I'm not okay, and that's okay. So what are the things that I can do on those days to help tomorrow be a better day?
Thank you, Carly, for your time and sharing your insight with us.
My pleasure.